Good evening, Panther Nation. Welcome to our Return to Campus in the Fall Town Hall meeting. I'm Jolene Butts-Freeman. I'm the Director of News and Media Relations for Clark Atlanta University, and it is a pleasure for me to serve as your moderator this evening. Now, this evening's Town Hall has been coordinated to share valuable information with you about returning to campus in the fall. We will discuss COVID-19 vaccinations and their importance to the AUC community. We have a special group of experts who are serving as panelists for this discussion. And at this time, I'd like to move forward with introducing those experts to you. Joining us this evening is Dr. Derek J. Robinson. Dr. Robinson, give us a wave there. He is the Vice President and Chief Medical Officer for Blue Cross Blue Shield of Illinois. In this role, he is responsible for care management operations, clinical leadership, and strategic oversight in providing high-value healthcare to more than 8 million members. That is a handful. He is Vice Chairman of the Board of Trustees at Xavier University of Louisiana, the nation's leading producer of African Americans who graduate from medical school. Next, we have Dr. Laura Joseph. Dr. Joseph, give us a little wave there. Thank you. Dr. Joseph is the Assistant Professor of Pediatrics and the Director of the Atlanta University Center Consortium Student Health and Wellness Center. Dr. Joseph's research and clinical interests are in college and reproductive health with a focus on long-acting reversible contraception. She also specializes in adolescent medicine and general pediatrics. Next is Dr. Christa Marie Singleton. Give us a wave, Dr. Singleton. She is a Senior Medical Advisor in the CDC's Office of the Associate Director for Policy and Strategy. In that role, she serves as a Senior Medical Advisor regarding planning with commercial insurer partners and physical providers for the CDC's 618 initiative as well. And she collaborates with the CDC's divisions for the 618's evidence summaries. Dr. Singleton also served as a Senior Medical Advisor in the CDC's Division of State and Local Readiness. Now, at this time, our panelists will share their opening remarks, and we're going to go in this order. We'll have Dr. Derek Robinson to go first, followed by Dr. Laura Joseph, followed by Dr. Christa Marie Singleton. Dr. Robinson, take it away.
Freeman, thank you very much, and good evening to everyone. It's certainly a pleasure to be with you all today. I have a strong HBCU pedigree with degrees from Xavier and Howard, but I think it's most important to note that I'm married to a Clark Atlanta University graduate from the class of 1998, and her friends and sorority sisters there at the Singleton chapter have always made me feel like I was part of the CAU family, so I'm really honored to be with you today. I also feel like it's really important privilege to be part of this very important discussion with this esteemed panel of experts today, because we're certainly trying to come out of one of the greatest pandemic that most of us have ever experienced in our lifetimes. And certainly in this audience, we have a number of students who've gotten vaccinated. We have students who are still weighing their options and taking in data points and trying to make some decisions. And we even have some who are fearful. And I think it's great to know that you have individuals in front of you, who've been vaccinated. I received my vaccine in December of last year and January of this year, but also individuals who understand very well the lived healthcare experience of African Americans in the United States, and also who are very knowledgeable regarding the results of the clinical trials and the experience of COVID-19 vaccinations, both domestically and around the world. And we're really excited to be in a different place today with the availability of highly effective and safe vaccines versus many of the experiences that we had last year as we were going about educating communities on COVID-19 risk mitigation. So again, I'm happy to be part of the discussion today and look forward to answering your questions. Ms. Freeman.
Thank you. Dr. Joseph.
So again, thank you all for joining. I'm honored to be a part of this panelist discussion this evening. As the director of the AUCC Student Health and Wellness Center, I felt it important to be present today just so that students and parents, faculty and staff and the like are able to hear why we feel this is so important in the upcoming academic year, why we are emphasizing and pushing for students to be vaccinated on our campus. There are many reasons, and I will go into that shortly, why we are all backing this mandate to have students and faculty and staff be vaccinated, and just what that means and what that looks like for students who are coming in and are hopeful and looking forward to starting this academic year strong and also feeling safe, and what that looks like in terms of masking and social distancing and whatnot. So we're hoping that by the end of this panelist discussion, some of your answers, hopefully all of your answers, questions rather, will be answered by one or all of us, and that you will leave here with a better sense of what to look forward to in August.
All right, thank you. Dr. Singleton?
Hi, good evening, everyone. It is a pleasure and an honor to be here. I grew up here in Atlanta. I went to high school here in Atlanta. I am the mother of a 15-year-old who's still a teenager going to school here in Atlanta. And I am the daughter of an 85-year-old who still lives here in Atlanta, who could not wait to get her vaccine when it was first offered to her. I'm here as a member of this community and look forward to answering your questions. Many of you likely have either questions or concerns, and those concerns are valid, and we're here to support you in your journey. As a member of the Centers for Disease Control, I'm here to tell you that we have had an incredible year with all of you all, and thanks to your work on the ground, we as a country have vaccinated close to 63% of American adults, but as well as though we realize that we have a long way to go within the African American community and the communities of color as a whole. And the fact remains that if you are not vaccinated, you still have the risk of getting this virus and spreading it to other people. And the more people that are vaccinated, the better and stronger we will be as a country and as a community of color. We want you to be able to get your questions answered so that you can go back to school this fall with the peace of mind that you are protected and that you don't risk spreading the virus to others. As a mother of a teenager, my son was concerned about getting the vaccination. He has asthma, and he thought about his experiences of being in the hospital, of huffing and puffing to breathe. And when it was posed to him, I was like, well, do you want to go back to that scenario, but worse? But also, do you want to go back to be able to do things with your friends without having to wear your mask? And he said, well, when you put it that way, I'm in. And so he's now 2 weeks out. He's working a job. He's going to a summer program, and we're on our way. So I'm hoping that we can help answer your questions to help you guys be on your way.
All right, well, I want to thank you all for those opening remarks. Thank you for setting the tone. And we're going to go ahead and move forward right into our questions. Is everybody ready? All right, here we go. Our first question, we're going to send this one to Dr. Joseph. Why is the vaccine required by the university?
All right, so pointing to the data out there right now, we know based on the data that the burden of transmission of SARS-CoV-2, that's the actual virus that causes the COVID-19 infection, lies in the 20 to 49-year-old age group. While we also know that data is showing us that the burden of hospitalizations and death lies in the elderly. So therefore, transmission again lies in the younger population, so the 20 to 49. So our student population would fit into that category, carries the burden of transmission. So people who are associated with institutions of higher learning, so I'm going to abbreviate that as IHEs. So that would include students, faculty, staff, and those living near or serving the IHE community. They may be vulnerable to COVID-19 because of the large number of people that we're going to have in close quarters on campus. And we also know that some aspects of college life are often not conducive to mitigating measures such as physical distancing and limiting contact, just by the sheer nature of being in close quarters in a residential housing facility, for example. So IHEs are not a closed community, and transmission is not limited to IHE attendees. So We know that staff members, faculty, students potentially can bring SARS-CoV-2 virus onto campus. They can also bring it home to their families during holiday breaks, at the end of the term, for example, at the end of the school year, and they can spread it to the surrounding community. So therefore, mandatory vaccinations will help to protect the health of faculty, staff, the surrounding community, and loved ones of students upon their return home. So mandatory vaccinations will also help to protect those who are unvaccinated. So those would fit, those people who are unvaccinated would have met the criteria for, medical exemption or other reasons for being exempt. So by looking out for those who potentially are unable to get vaccinated, we are able to protect them. And likewise, we're also able to protect, as I mentioned, your faculty members, right, who are coming into work every day, themselves vaccinated, staff members, and the surrounding community. And so fully or partially vaccinated study participants had about 40% less detectable virus in their nose. And so, i.e. that meant they had a lower viral load than others who did not get the vaccine. And they were also noted to have fewer virus particles, about six or fewer days compared to those who were unvaccinated. In addition, those who were partially or fully vaccinated in a study were 66% less likely to test positive for the SARS-CoV-2 virus infection more than 1 week compared to those who were unvaccinated. So while those measures that I just quoted, they're not a direct measure of a person's ability to spread the virus, they have been correlated with reduced spread of other viruses such as varicella influenza. So for those reasons that I just mentioned, it makes smart sense. It makes good sense for us to mandate our students, our faculty, staff to be vaccinated. We have the science that backs this up, and I will go into detail in another question about what exactly that science is. But we know that, one, again, just to summarize, we know that the burden of transmission of this virus lies in the 20 to 49-year-old population. We know that in just the higher institutions of higher learning, just by naturally, it's unlikely that we're going to be able to ensure that everyone is social distancing and limiting contact with others. For example, you're going to probably have a roommate, right? So it's going to be pretty hard to social distance within your dorm room, within the cafeteria, for example, okay, and other similar common spaces. And we also know that institutions of higher learning are also not a close community. So therefore, it behooves us to use the science that has now been proven to us, data-backed, to protect one another, to protect our families when we come home to them, to protect our faculty and our staff members. So that's why we are requiring that vaccinations be had by students and all.
So Dr. Singleton and Dr. Robinson, I want you guys to chime in as it relates to that question. I remember talking about community and talking about vaccinations as a whole, just the vaccinations that are required for people to return to school, just as a basic rule of thumb. So I wanted to talk about that. And I also want our guests to know that if they have any additional questions, you guys can place those questions in the Q&A section of our Zoom here. So you have the Q&A down there. Any additional questions that we may not get to, we'll make sure that we save those, answer those, and they'll be placed on our website for you to have the answers to. So at this time, Dr. Singleton and Dr. Robinson, can you chime in quickly for us?
Sure, I'd love to. Dr. Joseph, you knocked that out of the park. To those students who are concerned or saying, well, why is this a requirement? There is precedent, or basically a history of schools requiring vaccinations for entry to campus. You all may not realize this, but when you have to turn in your vaccination record, one of the vaccines that is likely required is a meningitis vaccine. And so those are there to prevent against what we call communicable disease spread. Again, I mentioned my son, he's on his way to a pre-college program. In 2 weeks, I have to prove to that university, not only his vaccination record, but a COVID record. There are over 50 universities or IHEs in this country, and a growing number, that are requiring this. So Clark Atlanta is not unique in its space. But another reason why this is so important, I explained it to some other young people. This virus is extremely contagious, and it is going toward places where people are not vaccinated. As Dr. Joseph mentioned, our elderly, our seniors in the community have largely been vaccinated. The group that's the gap area are our younger people. And the vaccine is the virus itself is very sneaky. It's like it changes its coat, its outer covering, to find a new host. So let's just say it wants to go to a club, and you're hanging out at the club, and everybody in the club's got on red, but the virus is wearing a blue coat. Well, he wants to blend in with the red people, so he's going to change up to get into the red, and then he gets in there and infects those people. They've got to find new places to live. And if the virus goes for younger people, because you all as a community are not vaccinated, we are seeing also that younger people are having what we call a longer haul situation, a long haul COVID. So you may think you're fine now, but we don't know what's going to happen to you if you get COVID for the long term. And so we'd hate to see your academic career in your future slow down because of something that could be prevented. So that's one of the reasons why we're really supporting this vaccination process. Dr. Robinson?
Hard to go behind these well-stated experts, but I'll see what I can add in. Let me start by saying that I'm not only speaking from the perspective of a healthcare leader, but also an emergency medicine physician. In the ER, we're used to being able to really get engaged in treatment to help address an issue and save lives. I think it's important for folks to understand that we do not have a cure for COVID-19. We don't have a cure. And so this opportunity for prevention through vaccination is extremely important. Many of the folks in the audience may not have had the experience of contracting chickenpox because we have a varicella vaccine that most young people receive. Most of us who are doctors have taken care of little kids with rotavirus. It would go through the whole house. Everybody would get horrible diarrhea. Most kids are vaccinated against that. We don't see polio. So as Dr. Singleton noted, the notion of getting vaccinated is not a new concept, but I think we should acknowledge that there's been, a lot of challenges that we face in the public space over the last year in terms of misinformation, disinformation, and a lot of distrust that exists. So we have to acknowledge that, but I think we also have to ensure that folks understand the real risk that exists. That today we have young people that are replacing our seniors who were in the hospital with COVID-19 last year. Now it's the younger folks. And these are also the demographics that are driving the rates of infection currently. And some of the things that we're also seeing in the data is reflecting that individuals who have COVID-19 and weren't hospitalized have a 60% chance of dying within 6 months, the next 6 months, 60% higher relative to individuals that were not infected with COVID-19. And we're seeing individuals that have been infected with COVID-19 and really had no symptoms developing new medical conditions that are being diagnosed, 6 months out from infection. So there are significant unknown risks related to COVID-19 infection that we will continue to learn about as we move forward with time. But we certainly want to ensure that as a community that we're taking steps that are going to ensure not only the safety and the well-being of our students, you all are, our future leaders, but also even the institution of the university, your professors and others that are part of that long legacy. So those are just a few thoughts I would have from the community perspective.
All right, thank you. Our next question is, many are confused about the rules for face coverings, mask wearing, and social distancing. What are the rules, Dr. Joseph?
So the rules are, here's where being vaccinated and not being vaccinated will play a role in what sort of guidelines that you would have to adhere to. And so as many are aware of the updated CDC's guidelines, now we have guidelines for those who are fully vaccinated and those who are not. So if you are fully vaccinated, you pose no risk really of transmitting the SARS-CoV-2 virus. You are able to go into closed spaces and open areas without having a mask on, whereas those who are unvaccinated, they may not. And so they're still, out of an abundance of caution, we're still requiring that folks who are unvaccinated continue to wear masks indoors and outdoors in gatherings, continue to social distance, okay, because we're trying to curtail the spread of this virus, and we want to contain it, and not just contain it, but continue to drive it, the rates and down. So we need to continue to do those things. For those who are fully vaccinated, travel restrictions, you are able to return from domestic and international travel. This is for the United States, and not have to quarantine, which is what we were doing before we had the COVID-19 vaccines, right, on the scene. And so those who are not vaccinated, if you do travel internationally, for example, you will have to come back in quarantine as we were doing before. And so those are some differences. Another difference, and this will be also pertinent, applicable to us, to our student population, is that if you are fully vaccinated, your testing for COVID-19 for the SARS-CoV-2 virus will be, infrequent. Okay, so we will have an established testing cadence for everyone on campus, including faculty, right? But for those who are fully vaccinated, you can expect not to be tested, every week or every 2 weeks, unless obviously you have symptoms that are concerning for COVID-19, in which case everyone should go ahead and get tested to ensure that you do not currently have the infection. But those who are unvaccinated will have to be tested more frequently, because we want to ensure that we are not having pockets of folks who are potentially in fact infected and are not presenting with any symptoms, which is what we call asymptomatic infection. As we know, those populations are able to transmit the virus, and we want to prevent any outbreaks on campus. And so those are some of the rules that would apply to folks who are fully vaccinated and folks who are not. So it does make sense, in terms of being a student, wanting to fully enjoy your campus experience. You've waited for this. Everyone is here to basically support you. Is here. They are excited to have you on campus. And what better way to come back on campus and to be able to do that in a safe way? And we have something that we can do to, like Dr. Singleton articulated, to prevent this, as we have in the past with other communicable diseases. And so why not do that? And that way you get on campus, be able to fully experience the campus and all that it has to offer in as near normal condition, pre-COVID conditions, as we can possibly have you experience this upcoming academic year.
All right. I'm going to direct this next question to Dr. Singleton and Dr. Robinson, and either one of you can start first. It doesn't matter. It says, since the FDA has only provided emergency use authorization of the vaccine, why are students required to take it? Let me repeat that. Since the FDA has only provided emergency use authorization of the vaccine, why are students required to take it? And I'm seeing some of the questions here in the Q&A section, and some of those same questions they match this one. So either one of you guys can start with that one, but I think they really would like to know, why is it required for them to take this vaccine?
I'll
Sure.
start. Well, I guess just so everyone knows, the federal government does not mandate or require vaccination for individuals. State or communities, as well as public and private schools, can do this. And so that is where Clark Atlanta is taking that step. And as I mentioned in my opening remarks, that all states require individuals to be vaccinated against certain communicable diseases as a condition of school attendance. And so again, this history is what is one of the things that's helping support Clark Atlanta in adding this into its section. But I'll turn to my colleague to add other components.
Yeah, I would just add that, this is, in my opinion, a strong leadership step by the university. And I think it's important for folks to, even under this emergency youth authorization, to appreciate that we've had 150 million plus individuals fully vaccinated in the United States against COVID-19 with these vaccinations. And I think despite a lot of the myths that folks have heard about, things we've seen on social media, nearly everyone in this audience can probably raise their hand saying that they know individuals who have died or who have been become severely ill from COVID-19. It would be hard pressed to find individuals in the audience that know individuals who have died or been significantly ill from getting a COVID-19 vaccine. So just an important, data point for people to register as we're thinking about and kind of imagining the potential, things that could go wrong based on all the stuff that we're hearing versus the reality that we have in front of us. I mean, we've had more than 600,000 people die in the United States from COVID-19, 33 million people infected. And in our communities, we're still seeing a lag in terms of African Americans that are getting and Latinos that are getting vaccinated relative to our representation in the population. But it's also important to note that there are a lot of risk factors that make that increase your risk of having complications from COVID-19: obesity, cardiovascular disease, diabetes, other chronic medical conditions. Those things have a high prevalence, a high representation in our communities, in your student population. And we know, as Dr. Singleton has noted, the age range of individuals who are getting infected with COVID-19 now and who are being hospitalized largely include this demographic age group. So there are multiple factors that point towards significant risk that need to be mitigated. And these are things that you really need to do as a community. I noticed in the chat that there were some concerns around maternal health and fertility. Keep in mind that the studies have shown that women who become infected with COVID-19 are more likely to have a premature delivery, more likely to have medical complications during pregnancy, more likely to die. They've looked at the data both nationally and domestically. So there's this large body of information that points towards the safety of the vaccines and their ability to mitigate many of the complications that we know about and many that we don't know about from the COVID-19 infection. So I think it's important to kind of dig into some of the things that give people pause and concern and really, speak to the minds and hearts to kind of move towards making that decision to get vaccinated. Again, I think the requirement is a leadership step. It's, being a fiduciary of that community to ensure that you're taking the right steps that are based in science. And we can all admit that there hasn't been strong, consistent congruence between, public health officials and their recommendations and maybe what we've seen from some of our political leaders over the last year, but we're in a better position on that now than we were at that time. And to the extent that CAU may be an outlier based on some of the comments in the state in terms of taking this step and others in the Atlanta University community, that's a positive, good thing, rooted in science and rooted in the best interests of the students and their families from across the country. And the last thing I'll state is that the CAU staff understand this better than I, but the worst phone calls that they make are also the death notifications that we as physicians have to make in a healthcare setting. And no one wants to be on the phone calling a parent to tell them that their child died from something that now we know that we can prevent through vaccinations.
I'd like to add one other comment. I saw the comments as well about fertility, just so that the young women or their parents that are listening in, is that several women during the trials of getting the safety of this vaccine, as well as we have now been following these millions of people who have been vaccinated, several young women got pregnant and have delivered healthy babies during this process. So they were vaccinated, they got pregnant, they have had healthy babies. So the vaccine is not adversely affecting their fertility. They are moving along just quite well. And the transmission risk to the babies are all healthy as well. And so we'll just put that out there so that if you have that concern and saying, well, maybe I'll just wait and see but you can be rest assured that we are following these cases. CDC has a very intensive safety monitoring program that once you get your vaccine, we have a smartphone app that's called Be Safe, where people check in, and we've actually pushed to get race and ethnicity data on that so we can follow how you react, don't react. And that's where we've been following all these young women and seeing these positive results.
All right. There's a question that I wanted to ask. It's not in my list here, but it was from one of our viewers, one of the students, and I wanted to go ahead and ask that question about your religion. Dr. Joseph, can you chime in on that particular question? One student said because of their religion, they're not able to take the vaccine, or would they be exempt, because of that?
Certainly. So we are, as I mentioned earlier, we are reviewing on a case-by-case basis requests for exemptions to taking any of the COVID-19 vaccines that are available right now. And so if you feel that due to religious reasons you would be unable to take the vaccine, then we're not going to argue that, certainly, right? Everyone's religion, that's something that's personal, and we're not looking for you to have to defend it, so to speak. And so that's something that we would look at, review, and move forward with. And so we know that we're going to have exemptions on campus. So again, our job is not to what we intend here is not to argue with everyone who does put in a request for an exemption to any of these vaccines, but we're really hoping that and I guess I'll just segue into I think one of the next questions, but we're really hoping that within each of our AUCC campuses, right, that we are achieving about 85 to 90% vaccination rate on each campus. Why would that number be good for us? So once we've reached that number, we would be more confident that we have achieved a good level of community immunity, and we would be able to go ahead and decrease our restrictions and have a more open campus, so to speak, as far as restrictions are concerned. Now, if we don't meet that goal around whereabouts around that range just quoted, then we need to really consider ourselves, as the CDC has stated, a mixed population. So we have a mixed population, which means that we have folks who are unvaccinated, and we have a good percentage of folks who are unvaccinated, as well as having folks who are vaccinated. But it's not enough for us to feel confident that we can lift the majority of our restrictions and have everyone be maskless and not social distance and the like. And so, referring back to the CDC's interim update on their interim guidance for fully vaccinated folks, this is on institutions of higher education. If you have a fully vaccinated campus, then we do not have to go and start the school year with, mandating everyone wear a mask indoors and outdoors and, social distancing, because the CDC has said that we can move away from that once we have a campus that's fully vaccinated. So we are aware, we're fully aware, we expect that we will have a small percentage of folks who will put in for requests for exemptions. And again, we're going to review them on a case-by-case basis, but we really hope that the majority of folks will go ahead and get that vaccine. That way we can start off the school year with having a majority of the campus be vaccinated, and therefore, like I said, we can decrease restrictions. And also, for those of us who are vaccinated in the majority, again, as I stated earlier, we would also be conferring protection to those who truly are unable to be vaccinated, and not just for religious reasons, but maybe for medical reasons as well.
All right, our next question is, what should I expect to experience after taking the vaccine? Dr. Robinson.
Sure. So the expectations after receiving the COVID-19 vaccine aren't that dramatically different than what individuals experience after getting other vaccines. So you can expect to get some local soreness at the site where you receive the injection. You may have a little bit of pain there, could have some redness. More generally, some people may also experience some fatigue or tiredness. Typically, these symptoms occur more after the second dose on the second day and usually resolve after that period of time. It's commonly noted that individuals can take, some of the medications that we give to little kids when they go to get their vaccines. So they usually get some acetaminophen or ibuprofen to help manage those symptoms. Just as a personal note, I received my tetanus and diphtheria booster last October, and it was much worse than getting the COVID-19 vaccine. I ached for about 5 days. When I took my first COVID vaccination, I had no symptoms. I had a little bit of arm soreness. After the second one, my wife, the physician, was also vaccinated. She had no symptoms with either dose.
All right. Dr. Joseph, should fully vaccinated people continue to wear face masks and social distance themselves from other people?
So again, citing the updated CDC's their interim guidance, like I just quoted, they are recommending that those who are fully vaccinated do not have to wear a face mask. They don't have to social distance, whether indoors or outdoors. However, right, everyone is still their own person. We're not going to be walking around policing everyone. Show me your vaccine card on campus. Okay, well, why are you wearing a mask? You don't need to wear a mask anymore. And so if for personal reasons you feel like you would be safer to continue to wear your mask as a fully vaccinated individual, you are perfectly well within your right to do so. If you are using sound judgment, right? So you're in a setting, maybe it's an indoor setting, it's a larger gathering, right? And maybe you just feel like there's not enough social distancing. Obviously you're not going to know who is and who's not vaccinated. If it makes you feel more comfortable to go ahead and put on your mask, to go ahead and social distance in that setting, then by all means, go ahead and do it. No one's going to knock you for doing that, right? So again, we're not going to force anyone to not wear a mask if they are indeed fully vaccinated. So that is still within your right to decide whether you want to continue to do that or not as a fully vaccinated individual. But just know that.
Slight caveat to that is, though, if you move, it is still right now, if you go on federal transit places, so if you get on MARTA, you may have to wear a mask. If you are traveling, either plane, train, that kind of point, you may have to wear a mask. There are still some businesses that require masks, so keep one in your pocket. But as Dr. Joseph was saying, you may, if you want to wear it, that's great. You may be around individuals who have a cold. We noticed this year that flu season was a lot milder because people were wearing masks. And so you've got people coughing and sneezing, or let's say you're visiting the child care center and our youngest children right now are not able to be vaccinated, you may elect to wear your mask. So there are places where you might want to keep one on hand, but as Dr. Joseph was saying, you don't have to wear it.
Yeah, and I just want to add on to Dr. Singleton's earlier comment and Dr. Joseph's note there that even as a healthcare professional fully vaccinated, I have 2 children that are ages 8 and 10. And so I continue to take some extra precautions because I know that they're vulnerable and they're not eligible to be vaccinated currently. And so even though the evidence reflects that the risk of someone vaccinated being able to transmit the virus is very low, I continue to take that extra level of precaution for their safety. And so I think that's just another thing for us just to think about from a community perspective as we think about these decisions, that again, there are folks within our communities that we care about that are vulnerable, and we want to ensure that we're taking the right steps to protect them and to protect ourselves. So I think that's something important to consider. And the last thing I'll note is it'd be very interesting when you sit in the classroom and so people start coughing, folks are going to kind of look around a little strange. And so, it's, you got to kind of think ahead because it will change the dynamics.
That kind of made me think of a recent situation actually that happened in my family where someone was carrying the virus unknowingly and went home around their grandparents, and then the parents tested positive for COVID and the grandparents tested positive, and one parent and one grandparent passed away, and that just it tore me up.
Devastating.
So yeah, it really was. So you have to think about community, you have to think about others, and that's kind of how I think about it, but that's just my personal perspective. Let's ask this question to Dr. Robinson. African Americans have had high levels of illness and death from COVID. Has anything changed?
Well, I think what has changed predominantly is that we do have an effective vaccine that's available. That's I think the big marker that has changed. We still have higher rates of death than most populations from COVID-19. That's not due to any genetic predisposition, but is directly connected to our increased level of exposure to the virus. We have more individuals that rely on public transportation versus having individual transportation. More individuals in our community that work in frontline roles, so they're exposed to more people. That higher rate of chronic medical conditions that lead to a more complicated course with COVID. We talked about those earlier: obesity, diabetes, cardiovascular disease, and others. And right now, despite the fact that we have effective vaccines available, either due to access issues and or concerns regarding safety or historical mistreatment, our level of vaccinations in our community is lower than our representation in the US population. So those are things that are within our control to address. And certainly we want to use this as an opportunity to ensure that the CAU students and their families and the communities are safe, and that we're able to again mitigate the significant trauma and heartache that we've seen across our communities, both through the loss of family members and individuals, as well as the economic impact of how this has affected our economies and individuals' ability to work, and the economic security of families affected multiple generations with this infection.
Okay. Dr. Singleton, what is the percent of someone getting sick after taking the vaccine, and why?
Well, as Dr. Robinson mentioned, that people do have, sometimes they have what we consider some mild side effects after getting the vaccine, and that's showing that your body is doing what it's supposed to be doing. If it's ginning up the proteins in your body to protect you. And so having those reactions, the pain at the site, maybe a mild headache, maybe feeling tired, we keep track of that, and so those are to be expected. In terms of how we CDC monitor the safety of these vaccines, I mentioned that when you get your vaccine, we encourage you to sign up for something called Be Safe. It's a smartphone text messaging that asks you, hello, Christa Marie, how are you feeling today? Have you had any symptoms? And what this does is that it gives us 3 or 4 questions, but it allows us to determine, wait, we're seeing this person's pointing out multiple symptoms. Let's call them, let's follow them. We have another system called VAERS, or the Vaccine Adverse Event Registry. And that process picks up if there's anything that we need to further study. And that's where we in real time can monitor and assess situations. We have seen, and I've seen in the chat, so I'll go ahead and bring it up. People are asking questions around something called myocarditis or pericarditis, which is a heart inflammation. What we are seeing is there have been about 300 cases, but remind you, let's do a little bit of math here. 300 cases as the numerator, the fraction, the denominator are these millions of vaccines. So that's a pretty small number. But because this popped up, people wanted to see, is there a connection? So on the left hand, we've got some cases of some heart inflammation that is mild, that goes away in 2 or 3 days. And we've got people who happen to get the vaccine. True, they might be related, they might not be, but that's what we do when we monitor the safety of the vaccine. We also had another situation with something called thrombocytosis or blood clots. Someone asked in the chat. I wanted to respond to that. And again, when you take away those 36 cases that were identified, compare that to a denominator of 11 million doses, what we determined is that, well, we saw in some women, in some situations, they should be aware of this mild increased risk, but that's what that means is that those individuals, you need to have a conversation with their provider, their healthcare provider. But again, we are not seeing any increased risk for those blood clots after these mRNA vaccines. And so again, the vaccine is proving, just like it did in the tests, that it is safe and is it effective, and people are not at increased risk for any sort of major side effects.
And if I
All
could
right,
just-
anyone could, no, go right ahead, Dr. Joseph.
I could just piggyback to what Dr. Singleton was just explaining about TTP, thrombotic thrombocytopenia purpura. So we know that, yes, there is a slightly increased risk of experiencing that syndrome when you have the Janssen COVID-19 vaccine, but we also know that we are able to counsel young women that there are other options, i.e. the mRNA vaccine options that they can take and that do not confer as high a risk, even though, again, it is rare to have this TTP occur, but there are other options. So it's not like it's one all or nothing in terms of the Janssen COVID-19 vaccine. If you are feeling unsure about it or not like that's the way that you want to go, it doesn't mean that now you are without options. So just remember that we still have the mRNA, the 2 mRNA vaccines, Pfizer and Moderna, that have a lower risk of this syndrome occurring. And I also want to point out that if you have COVID-19, your risk of having a thrombotic event is over 8 times, that of those who are the rate of those who have it after having taken, for example, the Janssen vaccine. So let's just make sure we're putting that into perspective too. In addition to what Dr. Singleton says, I mean, the numerator, yes, we understand that those are real cases, but the denominator, right? So millions of folks who've taken this vaccine and other vaccines for COVID-19 are doing fine after having taken the vaccine. So just keep that in perspective. And then also briefly about the myocarditis and pericarditis conditions that we are seeing in again, a few, subset of young people, typically under 30, who are having this after experience taking the vaccine. Again, for example, the American Academy of Pediatrics, the AAP, they have not changed in their continued recommendation that young people 12 and older should still go ahead and get vaccinated. And just as Dr. Singleton said, the amount of days that they have these symptoms of maybe chest pain, having perhaps a change in their EKG if you go to urgent care or ER, typically that will go away over, a week or so at the most, okay? And so we have studies that show that, over 80% of young people who experience any of these symptoms, cardiac symptoms, they were fine. They weren't, in most cases, they were discharged home and were okay. And so the guideline is not to, as soon as you get a vaccine, you need to run to your doctor's office and go get a cardiac workup done. But certainly if you do experience any of these symptoms, then you would want to seek medical attention.
I'll just add to Dr. Joseph's comment. Probably don't have time to get into an appropriate comparison, but there are a lot of other medications, treatments. You take oral contraceptives as an example. I mean, a lot of different medications that folks take on a regular basis that may have a risk profile that is higher than what we're talking about with the vaccine. And I think the inability to have those comparisons also robs us of some context as people are trying to grapple with the things that they hear about that may drive fear and concern relative to other decisions that they make on a daily basis that have a much higher risk profile. But I also just think it's important, and I think as trustworthy messengers, just to hear us. There's a difference in, sitting in an ER and watching ambulance after ambulance after ambulance come in with patients sick with COVID and knowing that there's very little that you can do. And there's a difference in talking to funeral home directors that have had to expand their morgues because they don't have enough places to put people that have passed, and family members that don't have money to take care of, funeral arrangements and that kind of thing. So the alternative here, choosing between not being vaccinated and the risks that come along with that, given the demographics of our community, and getting vaccinated, is a really stark difference. And I just think as trusted messengers and physicians who understand our experience, I think it's just important to convey the authentic concern about both what we have experienced over the last year or so with the pandemic, as well as the risk that people can continue to expose themselves to by not getting vaccinated, and how significant that can be to them and to their families.
It's heartbreaking right now. In the early days of the vaccination process, where it was almost like a Hunger Games of there wasn't enough vaccine to go around. And now you could pretty much go, to the grocery stores, to all these clinics, people are having it, and it's free. And then to hear stories, my own family members, I just found out I have a cousin who just spent 2 weeks in the ICU. He wasn't vaccinated. And then other members of his family got sick as well. And so here we are, June 22nd, where this has been available, and people are still not vaccinated. And, in our Black community, it's heartbreaking. And so we're just really want you all to think about this is safe. And for us in particular, we're really at higher risk for getting sick 2 weeks out of your life in the hospital or being dead. It's just not worth it. Please get the
Remember
vaccine.
the long lines we saw in Florida on TV when the vaccines first became available? People were camped out overnight, lines around the block. We just have to be sure that we're paying attention to the right signals and not, we don't want to fall for the okie doke around getting vaccinated. This is a significant issue.
We have lots of questions that are still coming in to the Q&A section of our Zoom. Some of those questions are about housing. And I want to thank Dean Torres for typing answers to those questions about housing and other questions while we talk about the COVID-19 vaccinations requirements. There's one last question, and then I want you guys to do your closing remarks because we are getting close to our time, actually 2 minutes away. So, but there's one question that says, there's a statement. So you're saying out of 5,300 colleges and universities in this country, less than 10% are required, and they so happen to be the Black colleges and universities. And you guys kind of already touched on the reason why. I want you to just say that once again to kind of help them better understand why this is being required.
Let me
in
make
addition
one
to,
quick.
Sure.
Yeah, quick comment here. To me, that doesn't sound as an outlier. If African Americans have experienced amongst the highest positivity rates from COVID-19, amongst the highest hospitalization rates from COVID-19, amongst the highest death rates from COVID-19, then it would make sense to me that institutions of higher learning that predominantly serve African American communities would be tuned into the issues that place their communities at highest risk, especially for students that are going to come from all over the country, co-mingle, live on campus, and what risk that exposes. And so you have, historically Black medical schools, including one right there in Atlanta, that are deeply engaged in, providing guidance to the universities to make decisions that are in the best interest of the students that they serve. So to me, it sounds like a well-informed decision. In fact, I would be surprised if it was the opposite. That's the question that we should be asking. So we don't want to too much get caught up in what everybody else is or is not doing, because that doesn't always represent the best guidance. Just to go back and remember about the discussion around whether to wear a mask or not, which states were saying wear a mask and which ones weren't, and how that tide turned over time. So again, we're trying to, I want to apply this, make this my closing comment. I want to applaud the university for its efforts. Also applaud the audience for your engagement today, the questions that you all are asking as well, the vulnerability that you demonstrate in doing that. It takes that dialogue and exchange for us to share our best information and to really be true and authentic. So I thank you all for the opportunity to participate.
I would agree with Dr. Robinson. For once, we as Black people, as a community of color, we're leading the pack. We're stepping out in front and saying we're going to protect our community. So again, we support what the university is doing. It's a great opportunity to protect our community. When Dr. Robinson mentioned that people are coming from all over the country, and I mentioned about how the virus loves to find unvaccinated people. So you take people coming from all over the country, coming to Atlanta, it's trying to find a home. The being vaccinated protects you against these variants, these hiding, these sneaky viruses. It's gonna protect you. So please get vaccinated, protect yourselves, protect your communities so that you can have the fullest chance for the young career at Clark Atlanta or wherever you choose to go. We want you to succeed and be successful and not have to go through the painful process of being seriously ill or worse yet, dying.
Right. And this is just would be one less concern, one less worry, right, as you are coming back on campus, is that you are fully prepared, you're armed with this prevention, a tool that we have in this vaccine. And so I want to thank our epidemiologist, Mrs. Kara Garrison, for providing some of this data here. I want to leave with just some stats right now in the state of Georgia. So as of last week, our viral lab test positivity rate, so our PCR test, last week was down to 2% in the state of Georgia. And so that, if you remember, for those who are Georgians or, visit here or live here, at one point it was as high as almost 20% in terms of our positivity rate. And so we know when you pull up the graphs, we know that we can see there's a correlation between when we really had the vaccine was promoted, increased promotion in our communities, and people really taking to the vaccine and going out there and getting vaccinated. So from end of spring semester, last semester, and now in 2-3 short months, we've seen our positivity rate really decrease. And that is because of people who are like you, asking the questions, wanting to know the data for themselves. And so I encourage everyone to go and go to the CDC's website, read up on this, see what the data is for your state, know when you're coming to Georgia. For example, the young people, which I want to applaud them in Georgia, in the age range of 20 to 24, 32% of Georgians in that age range have been vaccinated with at least one dose. And in the age range 25 to 34, 36%. And those 15 to 19, about 26%. So we have young people here in the state of Georgia who are just like you. They asked questions, they were curious. Some might have been hesitant, but they went out and they got vaccinated. And I'm sure that they feel, that much safer, being around their family members, hanging out with their friends now, going back, getting ready to go back to school come the fall. And we want the same for you too. And so we really hope that you take this into consideration. You go home and, you speak with your parents, you have a, candid discussion about what was shared with you today. And again, go ahead and research on your own too. Ask your doctor, okay, go to trusted sources, the Department of Health in your area, to obtain data, reliable data, right? Because like Dr. Robinson said, there is misinformation out there. We certainly don't want you to be confused and misled by that, but certainly the data will speak for itself, and you can see even within our own state here that the vaccine has worked. And so we want and we hope that you are able to come to campus, enjoy yourself safely, right? And get an education and really protect yourself and protect each other, because we are in the business of looking out for each other as a community.
Dr. Joseph, Dr. Singleton, Dr. Robinson, thank you all so very much for talking with us this evening and sharing this very valuable information as we move forward with momentum to open our campus at Clark Atlanta University in the fall. Now, to the students and to the parents who are on our call this evening, we want to encourage you to go to our website, that's cau.edu. You know it, it's www.cau.edu. If there are some other things that you might have missed because this call has been recorded. Again, thank you to our esteemed panelists. I also want to take time out to thank our online learning and continuing education team for providing technology this evening. Special thanks to Eli Phillips, our Chief Operating Officer. We also want to thank Dr. Torres, our Dean of Student Services and Campus Life. So all those questions about housing and anything else that you may have, his team will answer those. Feel free to email them. Guys, we will be responsive and know that we're moving as fast as we can for you and to be there for you. Additionally, want to thank Mr. Sam Burston. He is over Eureka, our new name actually, University Office of University Relations and the University Relations team. And of course, thank you to our esteemed president, Dr. George T. French Jr. For his tireless efforts and for the support of our scholars at CAU. Thank you for joining everybody. Thank you for joining us, everybody, and you all please have a good night.
Hello, I'm George T. French Jr., President of Clark Atlanta University. As we continue to navigate the COVID-19 pandemic, I know there may be some hesitation to get vaccinated, but each of us must do our parts individually to maintain the collective well-being of our community. Therefore, I encourage everyone to get the vaccine. Remember, we are all in this together, so each one get it done. Vaccinate.
Thank you. Well, yeah, I appreciate you saying that. She might need a text or an email from you because she was sharing with us that
Dr. Rose, if you will, can you hear me?
Hold on, hold on. Yeah, hold on a second, Eli. Let us call you back.
I think it's down to us now. Listen, you guys did a fantastic job.
Jim, you mean mute your phone on your computer?
Okay. I'm still doing it.
Okay, I just locked the webinar, so none of the students can chime back in.
Okay. You know, if it hasn't been said enough, I know Jolene made the attempt, but and I know I shared my note via text. I am significantly appreciative of everybody. I think it went resoundingly